Hey guys, so I wanted to talk a little bit about rhinoplasty today. So just a few of the basics. Patients often have many questions about this. Well, what is rhinoplasty? Well, essentially it's changing the shape and or function of the nose. So often the patient will have a breathing problem, maybe they do not, but you always have to think about both form and function of the nose because it is an organ, it's right in the center of your face, so it has to both work good and it has to look good, right? So you can't really separate those two things. So patients will often, say, well, what exactly goes into rhinoplasty? Well, just to explain the procedure a little bit, typically we'll take the patient to the operating room. I usually do this under a general anesthetic. There are some surgeons that do it under a twilight sleep or even local anesthesia. I like my patients to be comfortable, and so we let them drift off to sleep. Typically we'll make incisions either on the inside of the nose or across the bottom part. We call that the columella. This incision, the scar heals to be almost imperceptible, so I would not worry about that scar. Many patients often have concerns when you tell them you're going to make an incision there. But basically you lift the skin off the cartilage and bone of the nose, and then you can move around in any form or fashion that you like the cartilage and bone to make the shape changes to both breathe better as well as look better. Typically then you close the incisions with tiny, tiny sutures. These are often dissolvable as well as some that need to be removed. But these are tiny. We use little microscope glasses to put them in, so they're very small. We'll typically put some tape and a cast on the outside part of the nose. We'll typically put some little splints on the inside. Usually the patient is pretty stuffy after surgery. We don't pack the nose like they used to do in the old days where you put like miles and miles of ribbon gauze like a fire hose. We found that didn't significantly decrease bleeding when you looked at all the data, so we don't do that anymore. But we usually do put some plastic splints inside the nose and sometimes on the nostrils. And so with some of that hardware, it usually is a little bit more difficult to breathe for that first week. So sometimes patients will spend one night in the hospitals. Sometimes they'll go home. Typically, we'll see them back pretty regularly after their surgery. Usually at the 1 week time point, we'll take all the stitches out, the cast off, and the splints off, and everything. And so usually the nose is very puffy. So that's, I think, probably one of the biggest downsides to surgery on the external part of the nose is that, is the patient going to be able to, be around friends, family, people at work, and things like that. And often people are embarrassed about their nose, or that they might have had work done on their nose. And so, if you're a movie star, you head to Tahiti so the paparazzi don't see you. And many patients don't have that luxury, and they have to get back to work, get back to school. So for the first few weeks, the nose is quite puffy, and so that, I think, is one of the biggest detractors from doing surgery or rhinoplasty on the nose. And then the recovery is tough. You did surgery on the nose, so it's usually sore for a while. Patients can ooze blood after surgery, tend to make more snot, which is their body trying to heal itself. And then we like to see the patients regularly for follow-up and make sure that everything is healing appropriately. A lot of times we'll give the patient antibiotics, pain medication, medication for nausea afterwards. And there's lots of little tips and tricks that we teach you to try to make things better. Again, I think it's a great operation. Does fantastic things. Really can change patients' life and alter their appearance or their ability to exercise or get good sleep at night because they can breathe better. So it's a great operation, but one that we take very seriously. And if you have questions about this operation, please let us know, and we'll see if we can answer them for you. Thanks so much.